Hey, my name is Celeste Seeperish. I'm in NUR 212 and I'm going to be doing the shot doll simulation. So, for the simulation, before I go into the patient's room, I'm going to check the chart and see what the child needs today. So, for this child, the chart says that they need a flu injection, an MMR vaccine, a varicella vaccine, and Tylenol, PO. So I'm going to make sure that the child doesn't have any allergies on their chart listed for any of that stuff before I go in the room. I'm going to make sure that we have all those medications at the facility and that we have the proper equipment to do so. So upon finding that we have all of that, before I draw up the medications, I'm going to go into the room, introduce myself to the parents and to the child. I'm going to make sure that the child isn't running a fever, isn't sick, or any signs like that. So I'll do some vital signs on the child. Make sure that they don't have any new allergies to latex, any of the medications we're going to be giving. I'll make sure that the parents don't have any questions for the doctor or myself, which I would kind of refer them to the doctor. So after I do all that and everything's fine, I will step outside of the room and draw up the meds. So the first one that the child needs is a flu vaccine. So it's going to be an IM injection and the ordered amount is 0.5 mLs. So for an IM injection, you are going to use a 25 gauge needle that is 1 inch long. I already opened this because I messed up on another video, so this is take 2. Before I open the package, I'll check the integrity of it, which for this purpose it's sealed and fine. Make sure that the expiration date's fine, that there's no damage to the packaging or anything. So that's fine, everything looks good. This is sterile, so we're going to keep it sterile, and then our fluid for our injection is also sterile because the cap is on it. So technically I don't have to use alcohol, but it doesn't hurt if you do. So I'm going to open my needle packaging again, and I'm going to leave it like that. So to keep the inside of the package sterile, I'm just going to grab my needle out, and I'm going to make sure that the plunger is fine and working, and it is. And then I'm going to pop the cap off of my meds. And so to start, I am going to just pull this needle straight off and making sure that I have 0.5 mLs of air before I pull the cap off. Because this is a multi-dose bottle, we pull back and inject air. So I have my needle set at 0.5. And now I'm going to pull it off. And I'm going to put it on the edge so I can do the scoop technique to leave it loosely recapped. And leaving the vial on a hard surface, I'm going to poke. And I'm going to inject my 0.5 mLs of air. And then I'm going to flip it over and make sure that my needle is in the liquid, not getting air in it. So then I'll pull back 0.5 mLs of liquid. And I'll make sure I get any air bubbles out. Which hurts my finger on this syringe. Sorry, I know that noise is annoying. Okay, so once I got the 0.5 ml of fluid drawn up, I'm going to put it back on the hard surface, pull the needle out, and I'm going to loosely scoop the needle back into the cap, and I'm just going to lay it back in the package and save it for when we're getting ready to give the injections. The next injection ordered is MMR sub-Q 0.5 mLs. So for a sub-Q injection on an infant, we're going to use a 25 gauge needle that is 5/8 of an inch long. Again, keeping it sterile, I'm going to open the package. But before I open that, I'm going to open an alcohol wipe, and since this is a multi-dose, we're going to put that on top, so it's going to be clean when we need it. So I'm going to open my needle. And I'm going to grab the syringe, make sure it's fine, and I'm going to grab the needle and screw that on and make sure it's locked in good. And again, multi-dose, so I'm going to pull back 0.5 ml, like that. I'm going to clean the top of my alcohol off, or the top of my medication, pull the cap straight off, and then I'm going to stick that in there. I'll put my cap on the edge, inject my air, flip it over, and draw back my .5 mLs. Getting all the air bubbles out and making sure that we're at 0.5. Flip it back over, pull the needle out, and do the scoop method to recap. And again, I'll loosely place it on there and place it off to the side. So for the third one, he ordered a varicella injection sub-Q all again at 0.5 mLs, and this is going to be on a toddler. So we'd still use our 25 gauge 5/8 inch needle. And then I'm also, again, going to put my alcohol wipe on there, keeping it sterile, opening my package for sterile technique. Checking the packaging and the plunger. I checked the package of the other one too. Forgot to say that, but I did. Making sure the plunger works. We're going to get our 0.5 of air. I'm going to scrub the top of my medication vial. I'm going to pull straight off. Inject. And I got my 0.5 ml. So I'm going to flip it back over, pull the needle straight out, and do the scoop technique. And I'll place this over to the side. So now that I'm done with my medication, I'll clean it off just one more time. Make sure there's no medicine on it. Okay. Put that in there. So, before we give any injections, I'm going to grab my baby, a toddler, infant, and I'm going to give her 3.7 mLs of Tylenol that the doctor ordered, And we give this before the injections for like irritability purposes and to make sure the child doesn't have a fever. So I drew up some Tylenol. This isn't the normal syringe you would use. It's in 3.75 mLs. So when I go to give the Tylenol to the child, I'll either hold the baby like this and make sure I have this arm kind of tucked away so she can't hit my arm and shoo the medicine away, excuse me. And then I'll make sure her head is supported and elevated so she can't choke, or so she doesn't choke, to prevent it. And when I give it, I'm going to put it in the back pocket of her mouth. So I'd give a little and let her swallow it. Then I'd give a little bit more and let her swallow it. And then if the baby is seeming like she doesn't want to take the med or not swallowing it, I could put the pacifier in her mouth and initiate that suck and swallow reaction. And I wouldn't just give it to her all at once because she might spit it up, she might choke on it. So we're just going to give a little bit at a time to allow them to take the full dose, one, and so that they don't choke. And if the baby doesn't want to be held like this, I can lay them on the table and I'll support her. I would support her head with one hand behind her like this and keep her head elevated so she doesn't choke. And I would, again, just give a little bit, and let her take it all in. Okay, so she took her Tylenol like a good child would do. And so now we're going to start with our medications. For an IM injection on an infant, which is for the flu injection, we are going to give it in the vastus lateralis of their thigh. So the vastus lateralis is on the second third of their thigh. So you have, like at their knee, you would go like 1/3, 2/3, 3/3. So we're going to give it on the second third. And the vastus lateralis is on the side, not on the top. You wouldn't give an injection on the top of their thigh yet because it's IM. So we would go on the side because it's a little bit fattier. So I have my hot dog to demonstrate her thigh because I can't inject it into her. So we have, when I go to give the injection on the baby, I wouldn't just stick it straight in. You would give it at a 90-degree angle, but you have to pinch up that tissue some. I'm a lefty, so it's difficult. You have to pinch up that tissue and bulk it, and then you give the injection at a 90-degree angle. So, use my hot dog. So this is for the flu injection, which was 0.5 mLs, and we would put our gloves on. It's not necessarily recommended by the CDC that we wear gloves, but since we're in a doctor's office or in the hospital, we're going to wear them because we don't want to get what anybody has, and it makes the parents feel better. So I'm going to clean the site. So this is the vastus lateralis. Here's the vastus lateralis. I clean it. And let it dry. And I wouldn't reach over top of it. And if I were to give 2 injections in the child's thigh, we'd give them an inch apart. So I got my flu shot. And I had to stand up. So we have the flu injection. Right here, I'm going to let the cap fall off. And then we're going to pinch up. And we're going to give it at a 90-degree angle. Stick it in. And make sure the hub is at the skin. And I'm going to push the medicine all the way in. And then I'm going to pull the needle out, and I would recap it, or not recap it, I would use the safety feature, but since this needle doesn't have a safety feature, I'm going to safely recap it. Safely. And then I'm going to put it in my sharps. And then before I did that, I disposed of the needle, or I did the safety feature. I would put my Band-Aid on the baby, but since I would do that before I disposed of the needle, but since I had to recap that one, I just wanted to do that so I didn't get stuck. And then I put my Band-Aid on it. So that one's done. So now we have our sub-Q injections. So sub-Q, again, would be on the vastus lateralis, but instead of going in at a 90-degree angle like we did for the IM injection, we're going to go in at a 45. So I could use I'm going to go to the other thigh, and we're going to give, I'm going to open my Band-Aids first. In this thigh, we're going to give varicella, or MMR. This infant is getting MMR. So I got my Band-Aid ready, and I got my alcohol wipe. So we're giving 0.5 MMR sub-Q in the vastus lateralis at a 45-degree angle. So I will scrub on the vastus lateralis, which is the outer aspect of the thigh. And I'd scrub it, I'd let that dry, and then it's dry. So I'm going to grab my needle, make sure we are bevel up, and then I'm going to pinch up and at a 45-degree angle with the bevel up, I'm going to insert it and inject. And then we would take it out and activate the safety on a hard surface. Like that. And dispose of it in our sharps. And then I'll put my Band-Aid on and give it a little pressure. Okay. Then for the next one, we're going to give varicella sub-Q 0.5 mLs. And we're going to use a 25 gauge needle with a 5/8 inch length. I got my Band-Aid ready. I'm going to do this one an inch from the last one. So we're going to scrub with alcohol, let it dry. Okay, so I would not fan it. You never fan, but it's dry. I'm going to grab my needle. I'm going to make sure we are bevel up. And I'm going to pinch. Go in at, I don't know if you can see me, go in at a 45-degree angle. Inject. Let go. Pull out. And I would activate the safety, but this needle again doesn't have one. So for video purposes, I'm going to recap, even though recapping is not ever an option, or it shouldn't be. And then I will put my bandage on my child and see what happens. We would make sure that the child is not having any allergic reactions to any of the meds while in office. inform the parents that fever after injection is sometimes common, and what degree of the fever we would expect them to call the physician. So once the patient has their injections and their Band-Aids on, I can take my gloves off. I'll wash my hands, and I will clean up my room and just make sure that the child is okay and that the parents don't have any questions, and that's it.